slowly we can move on, and new people coming, we ask them to also to introduce themselves. I would like to shortly talk about our meeting. The main goal is a discussion forum, so it's not typical educational meeting with lectures, presentations, and so on. So it's not typical educational event. However, we are going to learn a lot of things. We get a lot of information through exchange of experience and from discussion. It's the opportunity to everybody to have the voice to speak. If someone doesn't speak English, you can use the translator and Google Translator and write on chat, so everybody can have input in this discussion. We are going to talk about current situation, current issues, hopefully good things, also about some problems we face in daily life, water practice. And I would like to invite everybody, especially if we are going to talk about difficulties and problems, to focus on solutions. So you can describe the problem, but try to look for what we can do, what the solution can be, rather than focusing on the problems instead. We have enough problems outside our homes nowadays. So we want to be on the bright side. We want to do brainstorming to find solutions, overcome the difficulties, and develop ourselves in these hard times. We start from. Oh, hello, Paulina. From Russia. She introduced herself also on the chat. Okay. So the first topic was about situation with current pandemic and how we deal with this situation, how problems we face, what we can do now, and what we can do hopefully in next future, near future, when we have some improvement in the situation because of spreading the vaccination process around the world. Maybe we can start again briefly. You can say, what is the situation in your country, and eventually in your practice, can you do Watsu? Can you do the sessions? And for the teachers, do you teach or not? What is the situation? Who wants to start?
So I start.
Thank you.
Italy. So in Italy, actually, at the moment, it's a little bit of chaos, like always, anyway. So the situation in Italy is that all the area is divided with different color. So we don't have one common criteria for the whole country. It depends which color the region is. So the red is the highest and the most dangerous one, and the yellow is the kind of well, not white, but kind of well. At the moment, the pandemic is going to be better. So things slowly are opening. But at the moment, the pool, the indoor pool, they will be open in a few weeks. No, sorry, the outdoor pool, they're gonna open. And the indoor pool, we are not sure when they will be open. We have a pool that are indoor and they're open, but they are the hydrotherapy pool. So, you know, they have like sanitary pool. And with Watsu, at the moment, it's not really allowed to do it in this moment of the year. We hope like in 1 month, when also the indoor pool they will be open, that we can start to do it. But you know, there is not really a clear regulation because Watsu is under the bio-natural discipline, and it goes a little bit with this part of the regulation, but it's not clear yet. So it's a kind that, you know, depends which region you are, then you have to follow and to be according to that region. So just to say it, it's not, you know, it's not open totally, starting very slowly, and again, not you know, Italy, there is the same regulation. So we really need to be aware of the region. We really need to be aware of the regulation of that particular region, and it's not the same everywhere. So it's a little bit mixed up. For sure, we still have to follow the rules with, you know, the mask and all the stuff, but we are in progress, still in progress. And that's it for now.
Okay, thank you very much.
So over here in the United States, each state is regulated differently. Massage pretty much has been open that I'm aware of for the other states. Ruth might be able to join in. But here in Arizona, massage is open. And if there is a Watsu pool, it can be utilized, but we wear masks. That's pretty, we have been teaching. We just did a class this week, but everybody does wear masks. And, you know, if you feel sick, you stay home. The last minute cancellations are happening often with it though. But not that bad. It's just going pretty well. So we've been teaching for probably over 8 months now.
So indeed, across the United States, like in Italy, each region is very different. And sometimes it's the individual state or the individual county, the individual regions within the states. So our massage therapists are working masks, shields, so not necessarily as close as normal in the pool, maybe slightly distanced because of the shield. And then like Chad said, with symptoms, now that more and more people are being vaccinated, that helps a lot. So things are slowly opening up. In my locale, I can't even get my outdoor pool to open up. So it's, some people live in fear and they personally don't want to take the risks. So it's varied.
Thank you.
Yes, I'm here in England. There are different rules for England, Wales, Scotland, and Northern Ireland, depending on where you live. But here in England, everything closed down over a year ago. The hydrotherapy pools, which are what I use in England, have not been open to outside use since the first lockdown, and care homes and everything closed to outside use. That's slowly changing. We have a very good vaccination program. A large portion of the population being vaccinated now, but it's very much the individual hydrotherapy pool situation which determines outside use. I think the clinical use is okay, and people are wearing full PPE. As my personal, for me, the pool I use is in a residential disability home, which has been not been allowed to open to outsiders at all. So I haven't been in the water for a while, over a year. So it's a difficult situation because we don't really have a sort of rule for Watsu. It's all according to the clinical environment, because outside pools are not really happening here. It's too cold. Yeah, that's the situation. I mean, things are gradually changing. We're on what they call a roadmap in England, where they're opening things up according to dates and according to whether there are cases recurring, more cases increasing with variants that are coming into this country. So it's looking hopeful, but it's anyone's guess at the moment. Thank you.
Thank you very much, Hilary.
Here in Madeira, to be honest, I'm not so sure about the pools. I think the pools are open for hydrotherapy sessions, but for the public, I don't think it's open yet. But the things are starting to open as well, slowly. In Portugal, in Madeira, no one practices Watsu here, so I don't know. But regarding Portugal, I think Watsu sessions are happening. I'm not sure, but I think it's happening. But I think it's with masks and yes, with the measures. Here in Madeira, no one practices, so I don't know about what's supposed to do regarding the situation and with Watsu. So I think I have a lot to figure it out regarding this situation.
Thank you very much, Patricia. Yes.
Tunisia, just to give you one maximum, and here are allowed. Words are allowed. Massage, Watsu, or that are in or the pools, but they are open air, so there's nothing. So this is everything which is in open air here is allowed. There are very, very few restrictions. So it's a bubble like in New Zealand or Australia is the situation. So even without the vaccine program, everything is working in the right way. So that's why I consider a good place to develop and consider it to promote more wax here. It becomes a really interesting place. Yes, this is the.
Thank you, Carlos.
I think in Germany, all pools are closed. In our region, all the pools in the hospitals where we use are closed, and the pools in the schools for handicapped people also closed. It's the same like in England since 1 year. No clients, no Watsu, but 2 weeks ago I knew that a colleague has a private pool, and so last Sunday I had with 2 colleagues Watsu. That was so nice. Yeah, but we will see in Germany. Oh, my English. The vaccination is also start very quick, and they talk about that people who have 2 vaccinations, maybe they can do. They have some privileges. Yeah, we will see. I don't know when it starts again.
Hi.
Thank you.
Hello. In Israel, we've very much been working for the last year, since May, under very strict regulation, of course. We're wearing either shield or mask, and things are pretty much going back to kind of normal, the new normal. And we do the Watsus again with masks, and this month we're starting with the courses again. Running Watsu courses. One of the main restrictions were working in groups, so that's been lifted. So hopefully we're going back to teaching and Watsu therapy. And most of the population is already vaccinated, so things are much safer now. Looks optimistic here.
Yes, thank you very much.
Hi everyone.
Okay.
It's me. It's Jonas. Can everyone hear me?
Yes, we can hear what is the situation in Taiwan.
Yeah, we not stop the medical service because we have a SARS experience. So from start, our life not stop, and pool open, clinic open. So our life is just like normal. So I hope everyone can restart your what's life. Yeah.
Okay. Thank you. And Ertan, please.
Yes, actually I'm going to talk about 2 countries. Turkey, now facing in this second big closure till 17th May. There's no service except in rehabilitation centers, in clinics, which patients needs to take all the measures and then reserve their place so that they can get the service they need. And the other all other public areas for local people are closed, but there's some exemptions for tourists and foreign people from abroad in touristic places, but it is, I think, out of scope right now. And for Saudi Arabia, as I was planning the first course in this country last year, in the beginning of March, but now we have just started planning a future Watsu basic courses, of course, first of all, and it will be combined with other programs like coaching hopefully in Saudi Arabia things are getting better. Thank you.
Thank you. Also, thank you, Ludmila, for presenting the situation in Ukraine on the chat, so everybody can see. Which is also not so optimistic. Not sure what is going to happen. For Poland, there is a in general. During the first lockdown, everything was closed. On the second lockdown, there was some exemptions, as Edita wrote on chat. A swimming pool were open only for national team training. So there are also the same with the fitness centers, musculation stuff. Everything was closed except of elite sport. So people were trying to avoid the system, and there are many. We get many new athletes registered in last year. So regular people were registering to the sport club to become an athlete and to be able to go to the gym or to the swimming pool. So it's a bit crazy. Some especially private rehabilitation centers with the pools, they were working, but obviously mostly for close population, for people who are living there or who are patients for this place. And the only possibility to work freely with Watsu actually is with the private pools. So if you have a private pool, you are lucky. I try to share the screen to show you one picture of the pool, of this example of pools we can work with Watsu. If I manage to find, okay, where it is? It is here. During pandemic in Poland, there are two pools. They are open, one last year and the second one this year. So people use the opportunity of being close to work on building the pools, and now more people can work. But in general, there is not so good situation. There is no good access to the pools, and also teaching is limited because of access to the pool, and also interest of the students, because people try to survive rather than to invest in education. I don't know if you can see the pool I am sharing. No. So where it is?
I've got a white screen.
Oh, so sorry. Okay, thank you. Anyway, I will try to show you later. So this is one of the pools built for Watsu especially. So if I managed, I'll show you later. So what is the situation in other countries? We didn't hear about Russia yet.
Thomas, I would like to say, I would like to put the optimistic view. Our pool was open all the time throughout the pandemic. We had the opportunity, because it's a hospital pool, of treating all non-corona patients, obviously wearing face masks. And we also taught our regular courses with 0 infections. So I think it gives an opportunity to say that it's very positive, and I hope soon in the near future that everybody will be back working in their pools, teaching.
Yes. Thank you. And what about France? What is the situation in France?
I don't know all, because I see now there will be some courses, but we don't have. We have to wear mask in the street, and there is. We have to go home before 7 p.m. But things are changing. We will more free in a few weeks. I don't know all about the pools and the roles. I'm not practicing now. I don't have pool around. So I'm not too much into that. I know some people practice with mask, and that soon there will be courses. Is that I know. But about myself, around me, there was few people who catch the sickness 6 months ago, but I didn't really see something like a pandemic. What I see from my eyes was not very challenging sickness. No, I don't know anyone who's dead about that or like this.
Thank you, Alice.
Soon it will be better. We all will be in the pools. Is what I want.
Yeah, because actually there has been some studies, no, that in water, it seems that water with chloro, it's really the safest place to be. You know? I don't know if you saw, there was some exchanging of some studies. So if this is gonna be proved, then we will be really lucky, because we can really go back to water, and this is a very good news.
Is what I see on Facebook, that the chlor, it's destroyed the virus. Anyway, it's very healthy what we do, so why can't we do?
Well, I agree with Carrie. We the thing is, it's not. It is already researched. It's already proved by research. So only the thing outside. If someone is sick, there is a problem outside when is the close contact with outside of the water. But inside water, for swimming, for this kind of activity, when the virus goes to the water, it gets kills in 30 seconds maximum. So it's a safe place. Well, it's the problem for Watsu is that we cannot have the social distance in Watsu in other aquatic bodywork, and we have long exposure for breathing, and the breath is very deep, and this is only problem for Watsu. But with using masks, we can also keep safe conditions doing Watsu. So, for example, in Poland, most of people are doing sessions with masks. I was teaching classes using masks, and we had no problems. I had not heard about some problems, some infections related to Watsu or aquatic and swimming pool activity.
Just to let you know that I have this article, but it's in Italian. In the break, I will just take out the researches where this news come from, and I will link to the chat, because the whole article is in Italian. Or maybe I put the whole article and then you Google it. But maybe it's better if I put the source where it comes, okay?
The links, yes, thank you. Thank you, Kelly. Simone, can you hear us? What can you say? What is the situation in Russia since you are there?
Oh, the situation maybe is because they have some rules, but no, it's totally free. We have made a lot of course, which free, anatomy, meditation, and we can give also a lot of session without mask and without no protection. So we are free at the moment.
And what about regulations? That they do not forbid such activity, or is just freedom of outside of regulations?
Maybe like freedom, like to go to the metro, only check the mask at the entrance, and after 1 meter after you can leave the mask and to be more free. This is the situation here in Russia.
Okay, thank you very much. Also, Ruth sent the links us on chat about article killing chlorine virus. Thank you, Ruth, for the link.
Victor, hello? Hello?
Hello, Roman.
Hello?
Welcome, and can you tell us what is the situation in the Czech Republic?
No. Ty máš jakoby ty dolní lavry, těch máš
Roman, can you hear us? Because we can hear you. Okay. Okay, we cannot hear. Okay. So as we can see, the situation is very different in different places, from total restriction to total freedom almost. In general, I would like to say a few things about what has been done from WABA towards the dealing with situation with COVID. And at the very beginning of pandemic, there was a research done by Peggy Schrödinger and Toru Osagawara from US. Peggy was from the US and Toru is from Japan, and both they did quite detailed research with practical indication how to apply this in our water practice, because there was no guidelines, there was no any instructions how to deal with the safety measures in Watsu. And also Toru gave us a gift with his tool, the beak. I don't know if you have heard, some of you for sure, and those who didn't heard, the beak is the plastic insider which you put under the mask, and this tool allows to keep the mask away from the face, from the mouth, even if the mask get wet. Because if you use standard mask in Watsu session and the mask get the water, it get wet, so it goes to the face and sometimes kind of glue to the mouth when you breathe, and this causes very unpleasant feelings, and sometimes even some gives some threat for the clients of losing the breath. So this big insider keeps the mask away from the mouth, even if if the masks get wet. So it is some helping tool for the receivers. You can go to Toru website and see or it is also on YouTube, the instruction how to prepare the beak from regular plastic document cover. So it's pretty simple and cheap solution. You can make by yourself this tool. So this is very interesting and very useful thing. And thank you, Toru, for sharing this with us. Also, US instructor ITC team create information intake form for patients coming for the sessions, which covers the all informations about history of contact with other people, of current state. So it is helpful in terms if someone gets sick, so you can easily find or easier ways to find people who are in contact with such person. Also, because I was serving last 4 years at WABA board, so we were working. We prepared 2 letters to the community, one at the early stage of pandemic and second kind of later, about informations about safety measures and some heartwarming words for people, because at the beginning, you may remember, it was very sad situation. The people were pessimistic, and we as a board, we wanted to increase the spirit in our water family. Also, Pavana came with the proposal of lowering the instructor's fee because of the pandemic, and the board approved the 50% decrease of annual instructor's fee for 2021. So those who doesn't teach, who are not active instructors, can pay less for 2021. And also there is for everybody, for practitioners as well, there is similar thing. So you can pay your membership fee even if you are not active, and if you want to come back to be a member, WABA member, and be visible in the registry, you can pay only the current year fee. You don't need to pay the previous year's payments. So this is because of COVID. And also the board gave some helping hand to young instructors on ITC paths. So there is a small lowering of the requirements for Watsu basic and Watsu 1 instructor. So they don't need to have 4 students and 2 new students in the class. There is some reduction in these requirements, and this is valid until June 13th this year, until my knowledge. And also in Poland, our Polish Watsu instructors, we gathered and decided to reduce our teaching fee by 35% in 2020 in order to lower the price for the students because of pandemics. So there several steps have been done in order to help practitioners, students, instructors, and the situation is getting better, but still, as we can hear, in some places it is difficult or very difficult. And even if the vaccination will be done, most population will be vaccinated, business will go back. There will be we need some time to recover, to go back to the previous activities as instructors or students, because they were worried about other things than education, than learning courses. They had to survive. They need, because some people lost the jobs. Some people had significant reduction in the incomes, and they need to survive. So educational purposes are secondary still. So until we come back to the teaching and learning activity as it was before pandemic, I think it takes another 2-3, maybe more years. So we need to find some solutions, and we need to prepare for activities in this recovery time. So here I would like to open the discussion to invite you to do some brainstorming. What do you think as instructors, as students, practitioners, what could be helpful for you in this recovery period?
I would like to add one suggestion to what you already said, Tomasz, and actually about tools to use in pool, you know, in this pandemic time. Because in Italy, some practitioner of the WABA Italia, the Association of Professionals, they made a research. This already on the after the first lockdown, let's say, and they made a research of all the masks, not all, but some masks that are in, you know, that you can find online. and they try it. And actually we found one that is really very good in the water, that I'm gonna put you here the name, because I was using a lot and it's very, very comfortable. It's a silicone. Can you say silicone? Yeah, you understand the silicone? Silicone mask, and has a filter covered with another silicone part. So it's very comfortable because it's really, they did the two types, and the second one is really well done, because the first part, it was the first one they did, it was like matching in the air was not good, but the second release, let's say, it's really very comfortable for the face. It does not get wet, and you know, in this way, it's, even if you then maybe wear something from the eyes, can really prevent also the person who is receiving maybe to wear the mask. Because what I found out, that for the one who is receiving in water, to wear a mask is really bad, really, really bad. So if we as practitioners, we can have a safe protection, this can prevent the receiver to use one. But of course, this is also up to the local restriction. So maybe it's not everywhere the same. But I just write here the name of this mask, so you can just have a look online and see if it can fit for you, because I found out really, really very good. And it's not so expensive. So you have the mask that stays, and you need to change only the very small filter. And they say, you know, you can wear like for 8 hours and then you can change. So I found it very good. So I just wanna give this suggestion to you. Just have a look.
Okay, thank you very much, Kelly, and thank you for the link.
Kelly, do you know where it's produced?
In Italy. I think it's an Italian product. I'm not sure actually, but I think it's in Italian. But I think that they send all over.
Thank you.
Okay, thank you very much. And also, I would like to refer to what Kelly just said, and I found maybe a key words is according to the local regulations. So for us as a practitioners, as the instructors, and as well as students who are practicing, I think the most important is to know the local regulation and follow them in terms of safety, because if we fail to do this and there was any infections and let's say kind of difficult or severe complications, including a death, there can be a liability thing. So people may sue us for not taking care about safety measures, and it is not only the issue for the person who is sued, so he or she needs to deal with court case, but also it can be harmful for the whole practice, for the Watsu name, because it will be associated with the Watsu activity. So I would like to invite you to get familiar and follow local regulations, which are changing as we know and as we experience.
I would like to talk about the new methods on authorizing Watsu, basic Watsu 1 and maybe Watsu 2 instructors, or some tentative methods that can be developed for a short period of time to to maintain the development of Watsu in different countries. For example, WABA board can consider about having an intense Watsu instructor training course to reduce the number of Watsu basic or Watsu 1 courses to be given by the candidate or by the instructor who wants to be a free Watsu 1 instructor or Watsu 2 instructor. So kind of intense training can be considered just for a short period of time to help develop, Watsu in different countries. Thank you.
Ertan, sorry, I think I really did not understand what you mean. Like to reduce the number of class. Can you repeat it again? Sorry.
Yeah, it is kind of that, but it's not just reducing, it is bringing to balance. We have Watsu 1 or Watsu instructor training program, which lasts 7 days. It is actually intense, but we can have such a program to accelerate the transition from, let's say, Watsu Basic to Watsu 1, or from Watsu 1 to Watsu 2 instructorship with an intense training program for one time. Why? Because there are lots of travel restrictions around the world, especially in Turkey still we have lots of restrictions, and also in this country that I'm working in, Saudi Arabia. So it could be one program instead of many travel requirements with the current requirements, because in the current requirements we need to have some 3 or 4 courses for each level to go to the next step, and for this time, current time, with this travel restrictions, I think it is a little bit intimidating. So just if there is a possibility to have a high intensity but less frequency courses, I think it would be helpful.
Okay, thank you.
Thank you.
Also, just to mention what also WABA came to help in this pandemic for instructor to go further with the process, is that allowed to do the online coach advisor. I did one for Russia, in the places where instructor, for example, from Italy, I could not go to Russia for the coach advisor because, the border were closed. So in this case, if there is quarantine or if there is no possibility for the senior or coach advisor, for the coach instructor to go in places, you can do online. And actually, as I said, I did the one coach advisor online, and it was really incredible. Really, it was very, of course, you can do the coach advisor because, as a coach, we don't enter in the teaching, but we just witness the instructor in training, what is doing in the pool, what is doing on land, what is saying. So we are there to support the new instructor. And I have to say, it was really working great, really working great. We had feedback in between, and of course the camera, we had Zoom, Simone had, because it was there, we had a Zoom connection all over the time. So I have to say this really works really well. And this is also a good support, for the new one to come. Yeah.
Thank you, Kylie. And yes, it is again the key word is here. When you can, there is this requirement, this extension is also done for these places where there is no possibility to come by the instructor. So some places are completely restricted. You cannot enter the country, or there is a huge, for example, 3 weeks of quarantine tests and so on, so on. So it's very, very difficult, or it's completely impossible to come. You can do such online thing. And just a comment to Eltan, it is definitely a topic to be considered by ESAC, the Educational Standards Advisory Committee. So you may submit this idea also to the board or to ESAC directly to be considered. We have some new people who arrived recently, so maybe I would like to invite you to introduce yourself briefly. Yes, Steven, please. Then can you hear us?
Hi, good morning.
Yes, please.
Hi, are you all listening me?
Yes.
Thank you. My name is Sandra Mayumi. I'm from Brazil, and I'm a very fresh beginner. I started Watsu last year in November, and I'm amazed with this technique. And thank you for the opportunity of joining you all and to learn more and to deepen my connection to Watsu. Thank you so much.
Thank you very much, Sandra.
Non, ça va.
Steven, can you hear us? Because we can hear you.
Hello.
Unmute yourself. Okay, can you introduce yourself briefly, please? And
Yes, like this, it's okay. So, hello, I'm from Switzerland, and I am a young teacher of Watsu One. I'm here to learn some news for the COVID situation. And I say hello to everybody, and thanks to accept me to the group.
thank you very much. Alexandra?
Yeah. Hello, everyone. My name is Alexandra. I am from Poland. I am instructor, Watsu instructor, and physiotherapist. I work with children with cerebral palsy in water and on land. So, hello everyone.
Thank you. Okay, so let's if because I see some people are present, but maybe are doing copy or stuff like this. So whenever they join, we can ask them to invite themselves, introduce themselves. And I would like to go back to this pandemic situation, and would like to invite you to share with the ideas what can be done, what can we do better to improve the situation. Okay, and what about your experience with wearing the masks during the sessions? Do you use it? You prefer not to use it?
I've found that I don't have issues wearing the mask while I'm giving a session. Especially if you wear the blue disposable ones, they're waterproof. The water just repels off. If I use a cloth one, I do have kind of like the beak. It's an insert that I put in to keep it off my face. But I don't find that there's an issue with it. An hour at a time, the breathing's it's not an issue. So you just take it off after the client leaves and breathe normally. But just for that one session, it doesn't seem to affect the breathing as much. I don't get a lot of bad feedback from my clients when they are wearing them. Sometimes they're like, do I have to wear that mask? But you know, it's just I just say it's our regulations right now, and after that, there's really no really other complaints.
Thank you.
In the session, in the Watsu sessions, I wear the mask, but I don't ask the clients to wear masks. Only me, because it's really too difficult for the clients, and it works fine.
Are there any, do therapists have to give like a form for the clients to fill in about the COVID situation? What do they feel, or the symptoms, or nothing like that?
In my experience, Patricia, this is also according to local law. Because again, for example, you know, if you keep all the, the data, you know, there is a privacy problem. the privacy policy. So it really depends on what is the local situation. In Italy, for example, like if the pool are in the rehab situation, in clinical situation, the clients already has been checked in by the clinic. So they take temperature. This is something that we normally do, you know, like when you go in pools or something, and they already gave their data, and, you know, they fill up that they don't have symptoms and all of this. There is something that we do, like for when we, in between the two lockdown, when we could teach, we had daily journal, you know, where every day we had to put the temperature and ask if they have symptom or not, but very simple question. And then after 14 days, we had to destroy the paper. Because, you know, these data, they are very delicate and vulnerable. So it's really need to be very much aware about the privacy policy in each state, in each places, in each country. This is my experience in also teaching, you know, that period of time where I could teach.
Thank you.
For teaching is similar like with giving sessions. So we have contact with people, and again it depends on local regulations. What I use in Poland and or other places where I teach, I use this for teaching. I use this adapted form from US ITC team instructors for the clients. And because, as Kelly said, it's very sensitive data. Actually, medical data is most sensitive in according to the GDPR rules, and supposed to be kept in very secured way, secured place. So, but because of COVID, this is a common practice that people are collecting such data. But normal procedure is to keep it for a short period of time. Kelly said about 14 days. We use 30 days, but this 30 days is a maximum. And after this, it has to be destroyed. So it has to be stored in safe way for 30 days, and then destroyed. So you need to be very careful about this, especially in the European Union, or if you teach or treat people from the European Union, you need to follow the GDPR regulations, and this is a serious issue in Europe now. Any other feedback with the masks from instructors, from practitioners, from your clients, students?
For me, as I said, I was using this eye mask, and this I found it very good. I could really breathe very well, and the clients also they did not wear the mask, and so it was very easy to give session. And, you know, in between one session and the other one, just take it out and breathe normally. But during the session, it's really safe, really, really safe, and it does not get wet. So for me, it was no problem at all. Yeah.
Thank you, Ertan, for the link for the eye masks.
Hi, good morning. I'm actually asking Kelly, and I ask you guys, what is that, the eye mask? What kind of mask is that? I'm sorry for not knowing that.
I will activate the link again.
Oh, thank you. Thank you. Thank you so much, Kelly. As for my experience here, we are wearing masks. We are wearing the beak and also those kind of disposal mask or fabric mask. And I have no problem on using that, even the clients. There are places here where we do Watsu, that is a regulation of the local, like clinics and this kind of places. So they ask both of us to use the mask, and other pools, just the practitioner is using the mask, not the client. And nobody actually has said something bad about wearing the mask. Of course, we prefer not because of the breathing, the freedom of the breathing, but it's going okay. Yeah.
Thank you, Sandra. And can you share with us a bit about situation in Brazil, because it's now there is one of the most problematic countries in terms of infections.
Yes, thank you, Thomas. Yes, the situation is very different in each part of the country. I mean, we are a huge country, and there are some cities and places that are worse than that. I hope I'm not the only Brazilian here. Am I the only Brazilian in Brazil in this room? Okay.
At this moment, yes, maybe.
Okay. And what we feel is that actually I started Watsu during the pandemics here. And I thought people would not come for the sessions, but because of the pandemics, a lot of people are actually looking for a kind of being, I don't know how to say this in English, but like embraced, or, you know, like to be comforted somehow, and to find some kind of deep relaxation, to find some kind of being connected to the essence of themselves. So that's why we are feeling that, of course, I've spoken to a lot of veterans, like pioneers, practitioners here in Brazil, and the people would come more before, but they're still coming because they ask, like, how does it work, about being infected or not, and the pool environment. So overall, we are in a very hard situation, like emotionally saying, energy saying, and of course, like healthy. But what we are seeing is that, like, what amazes me is how Watsu can really help people during this situation. I have been receiving kids, I have been receiving like elder people, I have been receiving the pregnant, and they really thank all the community. And most of people they don't know what Watsu is. So that's why, like, this is one of the most important thing for me to be with you guys here, is to learn more, is to have this overview of how is it going overall around the world, and how we can share of course, in the permission of each people who comes. We know that Watsu is for all, but not all the time, at any time. So how we can spread this respectfully and to make people know that this exists and how transforming this is. So this is this way.
Thank you very much, Sandra. You made a very smooth transition to the from problems to solutions, to positive side of the pandemic, because in my personal opinion, Watsu can be very important tool to help people with in recovery from this sadness, from this isolations, from exclusion. There's in Poland, and also I think in other countries, there's the reports are about significant rising rate of suiciders and in different ages. Young people, they are not coming to the schools. They are at home. They are attached to computers, to electronics, so that they're alienated from society. It's real life people. And for if this get for longer, in my opinion, it gets significant impact on the people's life. And what's with its values, this amazing gift from Harold, and we as a practitioners, instructors, students also who are sharing the sessions, we can help a lot and bring new hope to the people, starting from even a single session. So this is another topic I wish to invite you to discuss. Thank you, Sandra, one more time.
And it is great to hear that people didn't refrain from coming to Watsu sessions, as Sandra said. I would like to hear if there are other instructors or practitioners also saw the same thing. Do you see any? I just want to hear if you accept or see any tendency that people are willing to receive Watsu more, or at least you don't see any decrease. Because in general, people refrain that this is what we know. I just want to know if there's anyone who saw the same experience like Sandra.
So in some of our classes, people are hesitant for traveling, but they haven't really found people nervous to be in a class setting. It's more of a flying to get to where they're going. As for where I work in the spa service, the people who know about Watsu are very interested in getting Watsus, and people who are just learning about it, they aren't. Once they realize that I'm wearing a mask, it seems to they just kind of relax with it, and they have no hesitation. So the people are searching it out and wanting to do, and classes are happening. It's more the travel that people tend to be nervous about. Is what I'm seeing.
Thank you.
I see that as soon as people feel safer, now that with the vaccines and everything, they're coming more and more. As soon as the pools are open and the strict regulations are lifted, it's really, they're flooding in. They're really needed. And as someone says here, I think airtime, it's a great antidote for the social distancing, and people really feel that it's a great medicine for everything.
And probably in a near future, after everything is settled down, there is also a possibility to, you know, swarm in receiving Watsu or, you know, taking courses. So I'm hopeful. Thank you very much for your information.
Yeah, what I can say, that what I see here, that for sure students here in Italy, they are really looking forward to go back to the pool. It's really willing and longing, really longing. And I'm really sure, as you said also, and Ertan and Sandra as well, that if we are able to provide for a really safe environment in water, Watsu is something that can really be used to recover this social distancing. Because as also Thomas said, you know, people, there is a lot of lack of information about how COVID was infected people, not by the virus, but by the effect of the social distancing. And this is something that we can really work, you know, to be there with our presence, with our support in water and outside the water for the people. And as we all know, Watsu is such a caring and gentle way to come close to the people, that is really something that we all miss in this pandemic moment. So we really need to be very much aware of how we propose it, you know, and really to be very much aware of proposing it in a safe way. You know, for sure the vaccine is a good stuff, or believing or not believing, doesn't matter. But maybe also having a COVID test before, I don't know, there can be, you know, different situation where we can create a safe environment for clients to be. Because I truly believe that in a little while we can really have a lot of work, really a lot of work, and help people to recover this moment, and help also us, because, you know, we are part of this situation. Maybe, you know, we had much more tools, you know, to be present and to be aware. But it's true that these 2 years, it's affected our life in an incredible way, really incredible. So we really need to be very much present and really to offer these tools that we have. And Watsu for sure is one of the best. But I believe that we, as instructor or practitioner or also student, you know, we really need to be aware how we, how can I say, how we are present with the person, you know, besides our ideology. I don't know, because in Italy, not, I think all over the country, there is people who are, you know, they think that COVID did not exist, or they are against or pro-vaccine. And for me, our responsibility is not to be pro or against. It's just to be aware and just be there. So I really believe that our personal presence, without having any idea of this pandemic, it's really important. Like the mask that we wear. This I find out that in this moment is a great tool, really not to be on this side or the other side, but just to be present there. And I feel that to be able to support people in this moment, this is a tool that for me it's important to touch this kind of presence.
Thank you very much, Kelly. You touched the first very important outcome of this meeting, because yes, in the near future, we students, practitioners, instructors, everyone who is doing Watsu, we will have a lot of work with people. Also, of course, this safety measures are important. People need to feel safe, to relax, and to come in general to the session. So being present and also being neutral, because this discussion pro and cons, pandemic and vaccine and so on, it's getting stronger and stronger. For me, it's important, in my personal approach, it's important to stay neutral, but respect other people in terms of safety. So for at least I have to make a safety measure. I have to wear a mask in order to provide some safety to the clients and also myself. So if they will feel safe, if they will feel our presence and neutrality, they can enjoy Watsu, and they can enjoy benefits of Watsu for themselves in their situation where they are coming maybe first time outside home for many weeks. They receive a touch from someone else than the family member from maybe for many months, weeks or months. So these values from what's the benefits from what we know and we receive and provide, we can share them among these people, and this will be our personal responsibilities for everybody of us. And also it will be a kind of task for WABA, so I'm happy to have Ruth and Hagar from the board. So this is also, in my opinion, this is also a great opportunity for Watsu to develop, because as Ertan wrote, we have antidote for depression, for all these negative things which occurred during the pandemic, and we may say we are pretty lucky because we are pretty safe and living in pretty good conditions, but all these poor countries where there is a lot of problems with medical care and access to vaccines, to medical treatments, to hospitals and so on. So there's a lot of drama in the world in these COVID times, and there will be a lot of trauma stored in the bodies of people who lost their relatives, lost jobs and many things. So there's a lot of work for us, and I think it is also a kind of big opportunity for Watsu to develop using this tool of helping people with pandemic.
And regarding the use of mask, if we come back after vaccination and everything is over, it seems it can still not going to disappear quickly. Because it's not only issue of COVID-19. Some receiver may ask the practitioner, to use the mask. Yeah, in some cases it's possible that givers still or practitioners still use the mask. Just for personal responsibility, as Thomas said. I don't know if you agree with me. So it's kind of our, part of our life, because we have been using it for 2 years, almost 2 years. And if we consider, the receivers for any other contamination or to protect from contamination. So I think it can be one of the, equipment that we use in future.
So to clarify what you just said, are you saying that in the future, for depending upon where you work and how you work, that wearing masks may be the norm, that as we move forward in practice, that in some places we would consider wearing masks all the time?
I don't mean it's going to be a norm, but it's going to be an option. Some receiver may still ask, us to use mask. At least they want to feel at ease while receiving Watsu. So, I mean, it's possible that it will linger on.
Yeah. Thank you. Thank you.
Thank you.
Thank you. And I think the not wearing the mask will be the far future from now, because yes, with the vaccination progress is pretty good, but still we have all these different kinds of virus. So there's a lot of mutations and so on. So I recently heard there will be a second dose needed in next year, for example, because of new mutation and so on. So the masks were used a lot in Asia previously, and people there were used to wear it, and to this to see people on the streets wearing masks. For Western people, it was something new, something maybe strange. Now it's kind of norm everywhere, and if the question was if we will be asked by the client to wear the mask, I think it would be like with the earplugs. As a practitioner, we have to practice, so we need to have earplugs in case if the client is coming with some problem with ear, the water in the ear. So we can offer the earplugs for the session to help person to relax better. So now, even if we don't need to use the mask anymore, we will have to have earplugs in our toolbox and the masks in case if client asks us to use the mask because he or she feels more comfortable. And what is the situation in Taiwan? How you use the mask? You need to use the mask or not? How is the practice in Taiwan? Because you are now probably the only one representative of Asia here. So we want to know.
In Taiwan, we are not wearing about mask. We are not wearing.
Are you not wearing
a mask? Yeah, because they don't used to the client. They don't used to wearing a mask in the water. So Taiwan just a few people to get the infection, so we don't need to wear the mask in the water section. Yeah, but we have to ask the client the last week, have they been to anywhere a populate place for dangerous? If they did, we don't receive the service to them. Yeah. So we still having this problem about how to wear the mask in the water section. So I keep helping yours to think about the wear mask problem.
Thank you.
That's all.
Okay, thank you, Chia. Okay, so this topic is designed to be longer, but as I can see, everybody get used to the pandemic, and we find our own ways, our own solutions to deal with the problems of the situation. And it is interesting to hear how it works in different places, not only from the news, from the internet, but also from your own practice. And also, I would like to ask you for your feedback. What is about the fear of coming for the sessions or to the classes? Because there's many people they would like to come, but they live in the fear and they don't want to get risk in contact with other people, especially in close contact like in session. So what is your experience about that?
I would like to share my experience. So in this, I thank you everybody for the sharing, because there's very interesting to hear what happens around the world. Are you hearing me well? Because before maybe you went, that's good. So in the place where I am, so it's in French Polynesia, we have a very light restriction. So it's the opposite of some countries, is even really free. So the only really request we have that sometimes we have to use masks. But it's not only about mask, it's about all the environment we create. I'm not talking only about Watsu, but all the practices we do, body works, massages, and yoga. And what the people are looking is to feel safe and to feel good in the place where they're going. So what we are doing with our companies before they are coming in our place, we send them a notice with all the informations about how we are working at the moment, what protocols we're using, which products we're using to sanitize, how long they have to come before. And when they are arriving, we try to be very welcoming, explain them how is the place, etc. And I have noticed that they feel very comfortable with this. I say, even I am coming from a very place where the restrictions are very light. So even so here, the people feels very safe. It's very good when we're trying to apply these notices. And I think in the Watsu could be the same for everybody. If they receive a WhatsApp or SMS or an email before a session, and before arriving in the place, they already know what is going to happen. So that's something that I find very useful. Yes, this is my experience. I also noticed that we have more clients than before. Because there is something that people are looking for. They want to be safe. They want to feel good, to recover for what is happening, especially energetically and mentally and physically. So I am noticing that we are increasing it, and in this moment, I think Watsu have a big potential for this to support and to help people. So yeah.
Thank you, Carlos.
Yeah, you're welcome.
So for me, speak to hear me, maybe yes. I propose when I do courses, for example, next week I've got one course, and I propose to the student to make their own private tests. The test we put in the nose here in Switzerland, we can do found this in medical center, and we have 5 tests each month. And before to come, they do one test. It is not the PCR test, but another one, and they can do by their own. And like this, if the result of the SRS COVID test is negative, they can come. Like this is safetier, is more safety, and for the whole students, everybody is negative. So we are more confident with this. So this is what I propose to the students before to come. It is to make a test.
Okay, thank you, Stephen. Actually, this is a good idea for increasing the feeling of safety in the class, because this normal test, not PCR, this other tests you can buy for 10 euro already, so the price is not very high. And in general, when you travel between countries, so in most places you are required to have tests. And now European Union is going to introduce this green pass for COVID. So if you are vaccinated or you recovered from COVID, or you get negative result of the test, you have this pass. So this definitely will help people to feel safer, especially in the group. It can be also done maybe for individual session, but it increase the price, the cost of the session in general. So but in the classes it makes sense. It's a good idea. Thank you, Stephen, for sharing.
Yeah, I propose this only for classes, or because here in Switzerland the insurance take the price for the insurance, so it's free. We have 5 personal tests each month. So if someone is a little bit afraid, I propose them to find one, or I've got several on my place, and we can do together and wait the results. It takes maybe 30-40 minutes to have the results, but it's not really sometimes because we do this only in 2 centimeters in the nose, not very back like the PCR test. So it is just to make a little bit safe, a little bit confident that okay, it's okay. But I still propose to wear a mask. For example, for me, when I give a session, I take a mask with FFP2. Like this, I hope the virus don't come out and I don't take it in my body.
Okay, we've been talking about Watsu as a tool, or as a helping tool for recovery from COVID pandemic on mental level for the head and for the body. But there's also some people are already preparing the protocols of health of rehabilitation of people who recovered from the sickness, from recovery illness. And I think this is also good idea and good opportunity for Watsu in general, and for practitioners as well. Do you have any experience with protocols of rehabilitation after COVID, using Watsu or aquatic therapy in general?
So for body work, from my understanding, there's a 3-month waiting period after you have had a positive test of COVID because of possible blood clots. How that translates into Watsu, since we're not really manipulating the tissue, I don't think that the 3-month waiting period is as much needed. But that's what I have been told so far. But I've not heard anything else about that.
Thank you, Chad. And do you have any experience in pulmonary rehabilitation? So breathing exercises and in water and stuff like this as a rehabilitation tool after COVID?
I do not. But something to look into.
Because in general, the infection and the sickness is connected with the dysfunction and problems with dysfunction of lungs and problems with breathing, and it seems to be a good idea to start the rehabilitation, the movement activities from the water, where it's less less gravity. When we step into the water, we would decrease the gravity, so the movement is more easy. There is some resistance from water pressure, which we can also use as a tool for improving a breathing pattern for rehabilitation of the breath problems. So this I think is a topic and task for our colleagues who are PTs and rehabilitation specialists. So I see here some possibilities. Some of my students are already working on some such protocols. And beside of the mental recovery from this lockdown, physical and mental lockdown, there's many people who were infected with COVID and they need rehabilitation. There are some protocols of physiotherapy and osteopathic treatment for after COVID already done, and I think we can also find some applications and helping tools in this area with Watson. So this is a task for us to prepare such protocols.
Mm.
Okay, would you like to share on this topic something more? Okay. So maybe it will be a good time to make some short break. We can stretch our bodies, take some water. Only Stephen is active. We all are sitting. Stephen is doing some technical work in the pool, so we can see the heating pump, yes, and other stuff. But all of us, we are sitting, so let's make a small refresh break.